Well, hello, everyone. With us today, we have Kim Webb, who's the Executive Director of the Emergency Shelter of Northern Kentucky, and Danny Amrine CEO of Welcome House. Thank you both for your time this morning.
You're welcome. Thanks for having us.
Well, with ESNKY and Welcome House, guys, you do amazing work daily with a broad level of services for our community. But especially here as we are wrapping up 2020, you've had to do some amazing things to deal with the pandemic, to continue providing services. But especially as we've gone into this winter, both of you are dealing with new locations, temporary locations, new efforts. And that's what I think that maybe the community would be most interested to know about. So maybe if I could first, Kim, with you, maybe let us know briefly, what a previous winter looked like for services and now what this has looked like going into the end of 2020 here.
Yeah, so previously for us winters, it's kind of been a mix. We've had as many as 75 beds and 22 floor spots in our shelter, to last winter having 32 beds in Scott Street and then 59 beds at Salvation Army up on Scott Street as an overflow location. To this year, the reality that, due to COVID and social distancing, only being able to use a bottom bunk instead of a top and a bottom bunk, and taking away all the congregate areas meant that we were going to have space for 24 individuals in this building. And really it was 24 individuals that would come in and really be confined to a room to stay safe, to keep the staff safe, to keep volunteers safe, to keep themselves safe, to make sure that we follow all the protocols. And so, they were assigned a room and really had three things they could do. They could go to the bathroom, the shower, or the smoke break. Everything was delivered to them, and that was wearing on everybody. There's just a lot that goes with, in the field, of a moral injustice, right? We're here to help people. You want to connect to people, you want to talk to people and not do it behind a shower curtain. So after a couple of conversations on a regional level that Danny and I were lucky enough to have, it was Judge Steve Pendry who reached out to me and said, I've been talking to Jailer Jim Daly at Campbell County. We think we have a space. You want to come take a look at it? And, in all fairness, I was like, all I want to do is put the blinders up and just get through this winter to our new building in the fall. But there was everything to love about the Campbell County, the restricted custody facility, the RCF, and it allowed us to shelter 50 folks. It allowed us to have more showers, indoor courtyards that people could go in and out all night. Campbell County is doing our bed linens every night. They're providing evening meals during the week. There were a lot of things to really like. So, December 15th was monumental for us in many ways. We broke ground in our new facility that morning, and that evening was our first night in Campbell County. And, it's really the innovative and thinking outside the box by Judge Pendry and Jailer Daly to utilize an empty space that was not being used on the campus, and just forever grateful. And a half mile from here. So, like a half mile walking over the 4th Street Bridge. So there's a lot of things that, and it's the first time that really in Newport and Campbell County that they're sheltering folks, and we've had a very positive response. So, but we'll talk about that next.
You bet, and especially for low barrier sheltering, that's been huge, and that's fantastic. And Danny, with Welcome House, and we talk about sheltering the homeless, certain populations, you've typically focused on women and women with children. Talk about the change you've had to start here with the cold weather.
Yeah, our regional homeless collaborative kind of started talking pretty early this season. The pandemic kind of forced us to really take a look at our response system as a homeless response system and a collaborative early in the spring. So we were able to rise to that challenge. So we've been keeping that momentum up to really strategize as a group to see what the needs are. So we got together pretty early and quickly identified that there was going to be a pretty significant shortage of beds for this winter. So everybody was kind of trying to pull together, brainstorm, and see what options were available. We had a building that came up empty. We had a daycare that moved out. So we were able to talk with the city of Covington to see if we might be able to use that empty building to shelter up to 26 individuals with space for 8, a whole 3rd floor that's dedicated for people that have symptoms. So we were able to repurpose repurpose that building really quickly. And, you know, establish a relationship with the city to use CBDG funds, and also with KHC, getting some additional CARES Act dollars. Also, so that's been different for us. We case manage this population. We work a lot with this population, but we typically have not sheltered them outside of the early spring pandemic. But we're really excited for the opportunity to be able to help and add more beds to our region, which is already pretty low on beds. But also, we started sheltering in Boone for their emergency cold weather sheltering plan out in Boone County. So far we've had about 35 individuals that we have sheltered out in the Boone County area. And that's something new that Boone County really hasn't done before, very similar to Campbell County. So for me, from a regional perspective, to have every county coming forward and providing beds and thinking strategically about this population is pretty monumental for me.
Well, and it's obviously your all's, you know, your day-to-day work and your leadership to kind of bring this to the fore and make sure we all know about it. And obviously the work's not done. So you've got this new location in Newport with you, Kim, and expanded services in Covington with you at Welcome House, Danny. You know, what about as you go into this winter? We're going to be going into some of the coldest weather in the next week or two. What do you wish that the community would know about the population you're serving that maybe they don't know about today and looking into this cold weather? Kim, I'll let you go first if you don't mind.
I think, you know, what I'm hearing now is a lot of people, the understanding of the economic impact of a job loss has on families, right? And individuals that, you know, that often homelessness isn't a choice, right? And there's, you know, a great deal of education that has been occurring on a regional level for us to talk about this prior to the pandemic, right? Of, you know, addiction is not the number one reason someone is homeless, right? It is a loss of a job. You know, and I think also wrapping around that the fact that the only thing that's going to solve homelessness is affordable housing, places for people to live safely, healthily, you know, be healthy, and how much our region has really responded to the idea that housing, you know, is healthcare, housing is education, housing is financial stability, that it's really tied up in that tenet. You know, I think for us, it's really understanding that, you know, we continue to collaborate with all of our partners and to ensure that no one suffers or dies. And as we head into the winter, you know, we have the ability, the 50 beds over there, we're going to start providing services on Scott Street so that, you know, in the end of the day, you know, we still have individuals that don't have access to basic necessities in our community. We have a growing encampment population that's happening in Covington that, you know, we're going to start getting involved in and try to assist and making sure those individuals are connected to services. You know, just really trying at this point, you know, much like every other low barrier shelter in every community across the nation, the focus this winter is really about keeping people alive and just getting them connected to services, and don't hold, you know, open up the doors, which is what we've done for the last 13 plus years is, you know, if you just give them the bed, they, you know, and give them a couple of days and self-resolve and find space with often not needing any more intervention.
Mm-hmm.
And we see it time and time again with the population, and understanding that, you know, a single adult population is a national focus for everybody across the nation. You know, 2/3 of the population experiencing homelessness tonight is a single adult. 70% of them are men, 29% are women, and 1% is our LBGT community. So really wrapping our minds around the single adult population and the fact that they have a tremendous impact on our workforce in Northern Kentucky, on our healthcare, on education, on school, everything. So, you know, that's kind of what we're going to be looking at, and working hard to keep people as healthy as we can. And if we need to open up Scott Street, then definitely we'll consider that for the overflow beds in our community.
Well said. Danny, what's your message? What is your takeaway from coming at the end of this year, going into the coldest part of the year?
We've already seen a 400% increase in requests for services so far. We're seeing a lot of new faces that we've not seen before in our community that are experiencing homelessness for the first time. People with kids, families. So for us, it's really, how to step up and, collaboratively as a community meet those needs. And I don't think we've seen the worst of it yet.
Yep.
Luckily, there has been in Congress activity around, extending the moratorium on evictions, and a lot of good decisions that have been made politically that I think will kind of help offset. But we know that this tidal wave is coming. We're experiencing it already. We're finding people in storage units. So over the past weekend, we found a 70-year-old and a 68-year-old that were living in their car and then living in a storage unit. So a majority of the population that we're seeing now are people 60 and above with complicated health issues that, our nurses trying to keep up with. But we're starting to see the ramifications of the lack of affordable healthcare in Kentucky for so long. And now it's trying to address those needs and move on into the future and how to have a response for that.
Well, it seems as though, there's so many areas, and you all listed from affordable housing to healthcare, mental health, availability of just immediate short-term housing, et cetera. The flip side of that is the positive outtakes. It seems as though you've got urban cities, all three counties kind of stepping up in the unique ways to try and do their part. Obviously, the job is large ahead of us. But if there was one thing that I always ask this question to you guys, but if there was one thing that if I'm sitting in the suburbs or in my house in Northern Kentucky, and I've got a job, got food on the table, and my family is not dealing with the kind of challenges maybe that your clients are and your guests are, what's the one thing you would ask me to do in the next 12 months to help your effort and your mission of your organization? And Danny, I'm going to let you go first on this one.
Sure. So what's always meaningful for us is getting volunteers and getting people engaged in the work that we do. It's one thing, we're always looking for people to support us financially so we can provide pots and pans, we can provide rental assistance, paying past due utilities, things of that nature. But to really experience what it's like for this population and to see that mom who has a degree in biology with 2 kids having to spend Christmas in shelter, there isn't any other way that you can connect with that kind of story than to see it firsthand, whether it be by cooking a meal for the shelter or coming in and, delivering blankets or volunteering and getting active with the services to really understand that this population and demystify homelessness, that these are actually people. It's not a characteristic. It's not a flaw. It's a circumstance. So getting people engaged in the work that we do is really meaningful and beneficial for our agency.
Kim?
That homelessness is year round, that it's a 365-day a year problem for many, many folks. It's not just in the cold months. It's really hard to be homeless in the summer. It is the year-round volunteering. It is the year-round support. Everybody's got a tremendous, giving heart. I often say, and I probably said it, Kris, you probably heard me say this, I have the best job in the world. I see people in crisis, and we have a community that is so generous and giving. But homelessness is 365 days of the year. And when we get out of winter, that doesn't change for folks. The fact of the matter is they still don't have access to basic necessities. They still don't have an immediate bed to sleep in at night. And, the need is to continue to support that, whether that's volunteering, which, across the nation, everybody's seeing a reduction because typically it's your retired folks that are coming in and people are scared.
Sure.
It is financially supporting the future. We're building a 9,000 square foot facility over in West Covington. And, that's going to provide Northern Kentucky's first daytime navigation engagement center, which will be a place for our collaborative partners to come in and see guests and offer daytime showers and laundry. Actually, to be in a building that is designed to shelter people is going to be tremendous. And so I think that's what I would want people to know is there's lots of ways. Everybody's got time, talent, and treasure to give. And it really doesn't matter on how old you are. We see the youngest kids doing the most incredible things and volunteering and being really creative. And we see folks that just, drop off one pair of socks and say, I wish, I hope that this helps. Everything helps. Everything helps.
It's great. Well, I know you two would say this. I know you would list of all the other partners in the region. It's not just ESNKY. It's not just Welcome House. I mean, you've got Brighton Center. You've got so many organizations who are out there doing great work, and almost none of it overlaps, quite frankly. I mean, there's not a duplication. But, as while you also understand the challenges of property owners and of cities who are dealing with encampments and things of that nature. So I think it's your all's group working collectively to educate us, challenge us, and do better. Well, it makes us better as a community. So thank you both for your time. Happy New Year to you, and best of success in the future.
Happy New Year.
Thanks, Judge.
Thanks, Judge.